One of the most common injuries that we have that comes into our running clinic and physical therapy clinic is heel pain. Heel pain occurs in walkers, runners, and all different athletes. Finding the right or selecting the right athletic shoes will help to relieve pain and can even prevent heel pain. Two of the most important things you need to do or know when selecting a shoe is the mechanism of injury. How is the injury caused? And number two, you need to know the structural parameter of the shoes to select. We find our structural parameters by testing our shoes on the OPIS Index machine. We measure the rear foot, midfoot stability, we place it in our mathematical model, and we come out with the whole shoe stability index for each shoe. So let's go and look at the causes or the mechanisms of injury in heel pain. Heel pain is basically caused by increased tractional forces on the sub tissue under the foot. The two things that cause it are pronation and a tight calf complex. So as in the full weight bearing position, as the arch starts to drop, the tissue under the foot becomes stretched and creates a lot of traction on the heel here. And as you move forward with a tight heel complex, the heel comes up prematurely, causing more stress on the subtissue of the foot, and this causes inflammation here. So to reduce the amount of stress on the tissue, you want to have a shoe that has a high stability index rating so it reduces the pronation, and you want a high heel to toe ratio that lifts the heel up so it does not cause premature rising of the heel during the full weight bearing portion of walking. Shoes that are available for heel pain is those that have a high stability index rating. In other words, they have a high midfoot and rear foot stability rating to decrease the amount of pronation in the shoe. The other portion of that you need is to have a high heel to toe ratio to limit the rising of the heel during the weight bearing phase of gait. So the shoes that I would recommend would be the New Balance 1540, very high stability. I would recommend the Brooks Addiction 12, which is a great shoe, high stability. So that's right into this rating right here. And another shoe that you might want to consider is the Saucony Redeemer. These are all high stability shoes. They have high heel to toe ratios, and they're very good for heel pain. What you want to do is you want to stay away from shoes that are in this lower level because they are soft, they don't have enough stability, and they can actually create a negative heel to toe ratio when in the weight bearing position. And this causes more stress and traction on the tissues under the foot. If you'd like to have more information about injuries and how to select shoes to help relieve the injuries, please go to our website, www.shoetutor.com. You can also email me at orthosportspt@gmail.com if you would like specific shoe testing.